Your Excellency, the President and Commander-in-Chief of our Defense Forces, Your Excellency, the Deputy President, and all established protocols followed. I'm here and I'm honored to address this Health Summit on behalf of Parliament. Your Excellency, over these 2 days, delegates will speak of hospitals, will speak of funds, will speak of medicines and equipment, will speak of systems, will speak of outcomes. I wish to speak about one aspect that precedes all of them, and without which not one of them would exist, and this is the enabling legal framework. Your Excellency, Article 94 of our Constitution provides that the legislative authority of the Republic is derived from the people and is vested in and exercised by Parliament. At our independence, Your Excellency, our founding father pronounced that the incoming government of the people of Kenya was going to focus on fighting three things: poverty, ignorance, and disease. Over the years, efforts have been made in the health sector to achieve the war against diseases. In 1966, the National Health Insurance Fund was founded, and later in 1998, it was cemented into an Act of Parliament as NHIF, primarily to provide for medical cover for formal and informal sectors. The fund was operated by the National Hospital Insurance Fund Board of Management, and it relied on tiered flat rate monthly deductions as its contributions rather than proportional income scaling. Over the period, Your Excellency, the NHIF faced massive systemic corruption, losing billions of shillings through ghost clinics, inflated claims, collusion between rogue medical facilities and state officials. The reform journey that your government started, Your Excellency, has had the effect of addressing all this. Whenever you speak to any member of Parliament, Your Excellency, you'll hear always the same story. Desperate families calling at midnight about hospital emergencies and their attendant bills, their names being forced on fundraising committees and cards that are circulated without their knowledge, standing at hospital gates negotiating for the release of a patient, and at mortuaries negotiating for the release of bodies to their loved ones. Parliament understood the necessity of reform because parliamentarians have constant interaction with the needy in the population. The Departmental Committee on Health in the 12th Parliament had recommended, as it exited on the 8th of June 2022, that its successor should establish a facility improvement fund for county public health facilities. Section 104 of the Health Act of 2017 had also directed that legislation on health be enacted within 3 years. That instruction had remained unfulfilled. The National Hospital Insurance Fund, born in 1966 and governed by the 1998 Act, had long since been overtaken by the structure of our economy and dynamic social needs. So, Your Excellency, when you brought this agenda to the House of Parliament in your administration, you found an already convinced Parliament. Parliament had been waiting for the executive to act and it took courage from 1963. All successive governments had made half-hearted attempts to achieve what we now have in our country. In the year 2023, Parliament considered, interrogated, amended, and passed 4 statutes, which Your Excellency ascended to on the 19th of October of the same year. These were, first, the Primary Health Care Act, number 13 of 2023. It established for the first time in our history a legal framework for the delivery and management of primary health care through primary health care networks, and it placed our community health promoters on a statutory footing rather than leaving them to the whims of successive government initiatives. The second was the Facility Improvement Financing Act number 14 of 2023. This, anchored on Article 207 of the Constitution, permits a public health facility to retain and manage the revenue it generates. In plain language, money earned at a dispensary in Kimilili or Kilifi or Kacheliba is now spent and ought to be spent at that dispensary. The third piece of legislation was the Digital Health Act, number 15 of 2023. It discharged the unfinished obligation of the Health Act of 2017, established the Digital Health Agency, mandated a comprehensive integrated health information system for the whole Republic, and gave every Kenyan statutory protection over their personal health data. The fourth, the Social Health Insurance Act, the much talked about SHA, over which yours truly here was taken to court 6 times. It now, together with it establishes 3 public funds for primary health care, for social health insurance, and for emergency, chronic, and critical illnesses. 4 statutes passed in one session of Parliament, Your Excellency, was unprecedented. It is the most consequential body of social legislation enacted by any parliament in Kenya since independence. Far-reaching reforms are not always readily embraced and accepted. These 4 health bills were met with robust public debate. There were those who benefited from the gaps, flaws, and shortcomings of the status quo who did not welcome the reforms. These were in the minority. The majority of Kenyans saw this as a right trajectory in mitigating the myriad challenges that the health sector faced, and saw these legislations as a Damascus moment for our health sector. As we speak today, the number of Kenyans registered under the universal health coverage being a whopping over 30 million compared to about 8 million under NHIF will convince every doubting Thomas on the vision and foresight that informed these reforms. Numbers do not lie, and in law we say, res ipsa loquitur. Things speak for themselves. Under the Constitution, Parliament appropriates and divides revenues between the 2 levels of governments. It then has a mandate to ensure prudent use of those resources so that Kenyans get value for their money. I want to assure this summit that this is a duty that Parliament holds sacrosanct and will discharge without fear or favor. Parliament shall always ensure that any person or entity entrusted with management of public resources is accountable to the letter. Your Excellency, ladies and gentlemen, there are cases within the laws I have cited that require no financial contribution from citizens. These are primary health care, emergency, chronic and critical illness. That notwithstanding, the law has set out the Primary Health Care Fund and Emergency Illness and Critical Health Care Fund, which are financed from parliamentary appropriations. Even in such cases where ordinary citizens do not directly pay for those services, the funds draw the money from taxpayers' purse, while the degree and extent of responsibility must remain the same. Your Excellency, ladies and gentlemen, with all these good legislative reforms, questions are constantly raised by members of parliament on issues that this summit needs to address. Number one, rationalization of manpower or health professionals so that citizens in both urban and far-flung rural areas enjoy similar benefits and attention from our health sector workforce, including medical consultants. Two, the preventive and promotive care should be more enhanced to avoid costly curative remedies. Here we should place emphasis on regular physical checkups, clinics, advisory nutrition, fitness, immunization, counseling, etc. Three, cases of hemorrhaging funds from the healthcare system by individuals and health facilities, whether public or private, must be checked, and those found culpable must face the consequences. These include the war against ghost facilities that were very common under the defunct NHIF. I was happy as we went round to see that now we have an AI fraud engine that is dealing with this difficulty. The last, even where the citizen is required to make a financial contribution, the regulators should ensure that no unlawful charges are levied against any citizen. Your Excellency, distinguished delegates, ladies and gentlemen, as I conclude, I want to assure this summit that Parliament will discharge its responsibility to keep the health sector buoyant in our country. We will appropriate sufficient funds subject to the size of the envelope available and other national requirements. We will ensure appropriated funds are put to proper use, and together with the Auditor General, we will discharge these functions fully. We will remain open and ready to support the government with continuing legislative reforms to better existing laws and regulations and to give full meaning to health-related provisions in our Constitution and for the benefit of our country. I thank you.